traditionally, we've all been in our separate places working with a certain level of mistrust, and the industry forum is, there are people with lived experience here, there are academics, there are people from industry, learning how to speak the same language to do the work that will make a difference.
Yeah, so the National Centre for Creative Health focuses on systems and systems change, as well as on advancing good practice and research and collaboration and partnerships. And we really focus on lived experience. Across the board, the challenge is spread and adoption, and the difficulty around scaling interventions that we have reasonable evidence for, but we don't have the mechanisms for spreading them across systems. And there are real power imbalances, and part of it is about infrastructure, part of it is about funding and sustainability, so lots of challenges, but it will grow, I'm sure. There's great momentum.
I think there's a lot of opportunities for collaboration. I think the purpose of these events is to bring people together, have these discussions, and really get us energized and activated and thinking about these types of partnerships. I was really drawn to the talks this morning, particularly from the non-research community, because I think there's ways we can partner with companies creating pharmaceuticals and biotech. I think that people doing work in the tech space is really interesting because there's new ways of capturing and measuring data. And particularly creative health is really exciting because I think this is an area where the evidence is so rapidly changing. And so it's kind of getting in at the ground level of hopefully implementing change across health and social care.
So it's been a pleasure to be part of the industry forum. I think the goals of the mental health partnership are really well aligned with the challenges that we see as an industry partner trying to develop new precise treatments for patients with mental health conditions. We clearly need data to better understand the patient and to better understand their needs, and I think that that's really well aligned with the wider goals here. So I suppose the hope is that we can make sure that we're all working together to collect the right data and to make sure that it's fully harmonised, is available with the appropriate consent and ethical approval, so that we can actually make a difference to patients' lives.
People have put for far too long with therapies which aren't helpful or give them nasty side effects, or even just can't get access to services because of the long waiting list, and things need to change. Otherwise people are just getting, mental health issues will get worse. We need to think about the people who are going to use these therapies and give them agency on how they change their lives. So for me, it's one thing I want many of them, is actual things that we're going to do that will change people's lives. Don't have to do it immediately, but we have to have the next step, and then the next step, and the next step.